Welcome to Awareness to Action, a podcast brought to you by the Northwestern Community Services Board Prevention Department. I'm your host, Casey, a social worker and prevention specialist here in Virginia. Our podcast goal is to promote wellness through conversation, connection, and action. We hope each episode will leave you feeling inspired and motivated to look for ways to get involved in your own community. Hello, everyone, and Happy New Year. I'm excited for you to hear today's conversation with Tim May. Tim is a licensed professional counselor and the program manager of substance use services at Northwestern Community Services. Tim is responsible for program development, implementation, and provision of substance use services at Northwestern, which covers the counties of Shenandoah, Page, Frederick, Clark, Warren, and the city of Winchester. Tim has been providing substance use services since 1999, and you'll soon hear how very passionate he is about providing quality care to the people in his community. In this conversation, Tim and I discuss stigma around substance use, the connection between prevention and treatment, how to support a loved one in recovery, and the importance of self-care. We recorded this episode amidst the pandemic, so Tim is joining me via Zoom. Tim, welcome to the podcast. I'm so happy you're here with us.
Good to be here. Thanks for inviting me.
I'm just going to jump right into our questions.
Sure.
The first thing I want to ask you is you've had a long career in substance treatment and recovery. Why don't you tell our listeners a little bit about the work you currently do and the path that led you there?
Sure. So currently, I manage and direct the substance use services at Northwestern Community Services. So that's a wide variety of services, from early prevention to outpatient therapy services, intensive outpatient treatment, medication-assisted treatment, case management services, peer recovery services. Let's see, what else? I think I said case management, substance-exposed infant services. So all services relating to substance use, I manage and direct. I think the second part of your question was what led me to this. So I would say for me, I come from a family, my father was a pastor, so I grew up, watching him serve the community and help people. And I think in undergrad, I had exposure to substance use as far as with professors and providing treatment. So I was able to volunteer and do some practicum work. Personal experiences, people I knew. So it was just a passion early on. And it was just something, the more that I would do it, the more I loved it. It's not a job. I love what I do. And so, from those early years in college, I knew I wanted to go to graduate school. And so when I was in grad school, I continued studying substance use, volunteering, and then eventually doing internships and getting employed at a program. So it's something that I've always done, and I love I love it.
I love that it sounds like it's just this passion has continued to grow over time, because on this Awareness to Action podcast, we really try to talk about how usually the desire to make a change starts with just a little piece of interest and then grows. So I'm wondering if you can speak to what helps you to stay engaged and passionate about the work.
Yeah, for me, it's easy. I've always been someone that sort of rooted for the underdog. And I think the individuals that we serve, there's a huge stigma on those individuals. And a lot of people view them negatively. A lot of times the perception is they're never going to change. And so for me, I just have a passion, to jump in with them, support them and walk with them, trying to support them any way possible to try to see change occur, and support them. So for me, it's always about just walking with them. And it drives me every day. When I see individuals walk through our clinic, it motivates me. When they're in that door, I know we can be present with them and we can assist them. So, every day it motivates me. It's not a job. I love it. And I think all of my staff's the same way, and they motivate me because they all have that passion.
I think that's the best part about working with humans is that they continue to surprise you. They continue to show up, and I don't know, it's different and exciting every day.
It is. And I would say that, some people may argue me, but I think the population that I work with are some of the most authentic people in the world. What you see is what you get a lot. And I love the challenges, and so yeah, it's very enjoyable work, very satisfying.
So I think a daunting component of getting involved with anything is feeling like we don't know enough. And I'm hoping you can speak to how your own knowledge and learning has grown over the years to have you at the point that you are now.
Sure. When I first started, substance use is a field that is slowly progressing. We sort of stick to our old ways and we don't like to change, which is sad. So when I started, it was, a lot of treatment was based on accountability, punishment, sort of that belief system that, if clients knew what they were doing, they would change. So we have to, obviously they can't make the decision, so we have to do it for them. So it was very punitive. And man, I wish I could go back and change those early years. But what I learned is, that doesn't work, and so gradually over the years for me, it really became, just meeting people where they're at, and walking with them and having that relationship. And you hear that a lot in grad school where, it's about relationships. But I think early in my career, you're really focused on theories and techniques and theoretical orientations, and you kind of get fixated on that. And so as I've gotten old, to me, it's just about the relationship and, walking with these individuals, not giving up, treating it as a disease, treating it as a medical disease. And I think that's where I've grown the most. And I think we're seeing the field come around to that, where we are treating it as a disease, where we are treating it like diabetes. So yeah, that's where I've come from. I give examples when I speak all the time. When I first started, if a patient was late for group, we didn't let them enter, because we said, you need to be on time. And, you think about that and think, if you're 10 minutes late for a physician appointment, they don't kick you out. They still provide treatment, but we were so hardcore. So really for us at Northwestern, it's really treating it as a disease, treating addiction as a disease, changing our language. We use such negative language when we're working with individuals in treatment. Some of the old language was dirty and clean. If someone had a urine screen and it wasn't favorable, we said it was dirty. And if it was a good, positive urine screen, a favorable urine screen, we said it was clean. And I say all the time, if you get lab work at your physician's office, they don't come out and say, your lab work's dirty, and so there's that huge stigma, for me, and that's changed over the years where we really look at changing our language, just changing how we do treatment, meeting folks where they are, understanding that when someone gets in treatment, there may be setbacks. Someone may relapse. It's not the end of the world. We all have that in our life. Anytime we're trying to make a significant change and someone in treatment, that's huge, man. I'm so proud of them for taking that step to address that. But we all in our personal lives, when there's something really significant that we need to change, I doubt if any of us change overnight. There's going to be setbacks. So again, early on, I was sort of driven that here's the goal, this needs to happen. And I think now it's more realistic. Let's meet people where they're at. Let's care for them. The analogy I give a lot is I'm an outdoorsman, a fisherman, and I say all the time, our patients, are steering the boat, and we're on the boat with them with our arm around them, and to the right of the boat may be rocky waves, and in front of them may be really rough waves, and to the left may be calm seas. And if they decide to go where the waves are, we're going to put our arms around them and try to help them steer the boat where it's calm. But we're never going to leave their side. We're going to support them. So long answer, but just for us at Northwestern, it's about meeting folks where they're at.
A long answer, but a good answer. And I'm really grateful that you mentioned language, because language can be so stigmatizing. I'm wondering if you can offer some examples of positive language to use when discussing substance use disorders, so that they can maybe have some ways to change their words and their rhetoric.
Yeah, I think, just treat them like people. They're people. When someone's trying to lose weight, we don't use all kind of negative language. We're all proud that they're trying, right? And we use positive language because we want to encourage them. So I think going back to, like language we use when they give screens, or we say, they're in treatment. We don't use the word addict. Like, if you have high blood pressure, they don't call you a hypertensionist or whatever, right? They call you a Tim with high blood pressure or whatever. So, that has high, just changing the language as far as, they're human beings, calling them by their name, they're in treatment. I do a whole thing on language, because our language it's so negative the way we've used it in the past. And again, if there's anything that people can take out of this, I think just understanding the stigma that the individuals that we work with face, a big stigma they face is, one of the biggest evidence-based treatments right now, and it's a tool in our toolbox that we can use, is medication-assisted treatment. Some individuals that's on medication-assisted treatment, they're scared to say anything because people will say, it's a crutch. You shouldn't be on medication. But where else do we do that? In any type of other types of diseases? If you're diabetic, we don't say it's a crutch that you're taking medication, or if you're taking medication for hypertension, we don't say, well, if you lose weight, you may not have to take a pill, right? We're okay with that. Or if you have depression, anxiety. So I think, again, for me, but then also for my staff, it's about getting rid of all that stigma. And I think our patients see that by the way we interact with them. They feel like a human being. They don't feel dirty. They don't feel like they're, a moral failure, which was a lot of how treatment was viewed back in the day. And individuals that were in treatment, some people thought, it's this moral failure. This is a bad person. And at the end of the day, for me, that's somebody's son or daughter. And gosh, I want to treat these individuals with as much respect and care for them, and offer them the best treatment possible.
Absolutely. And I just want to offer to our listeners the idea that changing your language is such an easy way to get started in just really being more empathetic and compassionate for people who are in recovery. That's like just a really great place to start, I think.
Yeah. And we, again, like with relapse, we don't really use relapse a lot. We'll say, it's a setback, because it's not the end of the world. In the old days of treatment, if someone had a setback and used, it was the end of the world, and it meant they had to go to inpatient treatment. And, that's not always the case. So yeah, we work really hard on language. Yeah.
So shifting gears a little bit, Tim, I know that you come from the treatment realm, but in our department, we love to talk about prevention.
Sure.
Are there things that can be done to decrease the rates of substance use disorders in the community?
$1 million question, right? I think, any type of prevention work, in the schools, any type of education, first and foremost is important. I think parents, being open and having conversations with their children, honest conversations. I think with everything in our lives now being so stressful, I'm not sure how many conversations are had at the dinner table anymore, where everyone's there because everybody's busy. But I think, the schools, and I hate putting more on the schools and individuals in the schools, they have a lot to do. But I think any type of prevention education work in the school system, educating parents, and also encouraging parents, to talk to their children, to talk, and again, not from really a punitive nature, but where you can have open, honest dialogue, where your children feel comfortable having those conversations. I think Virginia, as a state, has done a good job in the past 3 years of opening up more resources for individuals seeking services. I think that's a big thing for reducing maybe use or at least helping individuals get more treatment. So they've created the arts program, which has opened up more services to individuals with Medicaid. So I think also increasing services, making it easier for providers to provide services. I think all of those things can certainly play its part in reducing use.
There are so many different ways to come at something that's happening in the community and affecting a lot of people. And I think that's why treatment and prevention are so exciting, because there's so many avenues for people to get engaged in the work. For someone who doesn't feel like direct work is really their thing, but does an amazing job with community education, there's a place for them in this work. And I think that's just very hopeful.
Yeah. Yeah. And I think, again, the more we can do about reducing the stigma, a lot of times that happens when it hits close to home, right? So you may have a certain view, and then maybe you have a family member, and all of a sudden that changes things. For me, I think all the time before I had kids, I'd be in Walmart with my wife, and we'd see kids running around and, having a good time. We'd say, that's never going to happen. We're not going to let our kids run, But then you have kids and your worldview changes, right? And that's the same way I think we can work with prevention and educating our community. Obviously, when it hits close to home, it changes things, but also just educating our community that, educating them on recovery, educating them on treatment. I read a lot, I used to read posts on Facebook. I try not to do it anymore, when there would be arrests or something. And some of the posts, was like, throw that garbage, it would be someone arrested for drug use or whatever. And it would be, throw the garbage away, or, it was just so negative. And, and I think just educating our community on what's out there, that it is a disease, that it's not something that you go to one group and you're, magically cured. This is a process. This is a process that takes time, and what it takes to support someone in treatment and in recovery. So I think all of those things can really assist, our communities.
I think it's really important that you highlight the time and patience that it requires. I know multiple people in recovery who have said that they didn't understand the phrase one day at a time until they were walking that path and truly taking it one day at a time. And I think that's important for anyone engaging with anybody in recovery to remember.
Yeah, I think, in my experience, I think anyone in treatment is probably stopping substance use is probably one of the hardest things you can do in your life. I think losing weight's easier. I think there's all kinds of changes. That's a lot easier than that, because you're talking about physiological issues, psychological components, biological, genetic, it's tremendous. And it is one day at a time, and for us as treatment providers, it's walking with them every day, understanding that there can be setbacks. And, one of the things that we encourage our patients is don't ever get too high, don't ever get too low. Let's try to stay kind of balanced. But recognizing, we're all human beings. We're going to have good days, we're going to have bad days. And when we're having bad days, making sure that we recognize our support, what can help us. And obviously, I think our peer program really lends itself to that, where our patients have individuals that's been there and done that, that's in recovery, that's certified. They can reach out, go to a meeting with them, just go to the park, hang out. But it is one day at a time. And it's not something, again, I tell people all the time, it's not a magic pill for this. It's a lifelong process, but you can do it. And I see people doing it every single day, and it keeps me going. It's great.
You mentioned some of the factors that contribute to a substance use disorder. I'm wondering if you can speak to some of the commonalities you've seen during your years in the field regarding those factors that can contribute.
Yeah, I say this all the time. For me, I've been in this a long time. I'm feeling really old. And I think when you're in this, I would say my peers would agree with me that we've always had a substance use problem. Like always. Like for me, it's always, I hear the word epidemic now, but to me, we've always had an epidemic. It just kind of changes with what drugs the epidemic, right? So I think the factors now are obviously with the epidemic, with COVID, the pandemic, I should say, that's obviously playing a huge role now with isolation, and we're seeing increases, with individuals just not being able to get out and do things. But I think stress, one of the biggest things for me is hope. I think when individuals don't have hope, that's tough. And I think a lot of our individuals we work with, they've lost hope. They don't feel like they can make it. They feel their worldview, their self-view is very negative. So I think, obviously there's biological genetic factors, but I also think there's the hope factor. And when you take hope away from someone, that's a rough place to be. That's a really scary place to be. And so, for us, again, part of our role is to try to shine that light of hope, that there is hope, you can make it. So I guess to answer your question, I would say the same factors 20 years ago are the same factors to now, but obviously with the pandemic, I think we're seeing more, we're obviously seeing more overdoses, more substance use. Isolation plays a huge role, right? Because we're social beings. We want to be around people. So I would say those are some of the common themes in my career. But I would say if I could say one word, that most of the people I've worked with is just that self-worth and hope sometimes, with all the other things going on in their life that can kind of contribute to substance use.
Yeah, there's a lot of interconnected factors for sure.
Yes.
Recovery can be defined in so many ways. I'm curious what recovery means to you.
Yeah. I could talk all day about recovery. For me, recovery, you're getting better. You're improving your health. You're improving your wellness to achieve your goals. And I would say it's like recovery from a broken bone, right? You're recovering, you're getting better, you're learning, you're taking all the tools that you learned and you're applying it to your life so you can have a great life. Again, recovery is one day at a time. Doesn't mean you're in recovery and you're not going to have a bad day, right? Because you can break your leg and your leg's still going to hurt at times. But for me, you're learning all those tools and you're applying it to your life. You're applying it to your emotional well-being, your physical well-being, your social well-being. So I was saying a really short definition, that would be my, definition of recovery.
So how can a person that hasn't experienced addiction support a person who's in that recovery?
Yeah. Again, for me, I would say just being there for them, being present, supporting them, having an open mind when they call, non-judgmental. I think if you've not used or you're not familiar with recovery, any type of education that you can learn. For me, the American Society of Addiction Medicine, ASAM, any material that's produced by them, I think is really good. Volunteering, we'll take volunteers. There's a process at Northwestern. But I think any of those things that I mentioned are good ways of learning more about addiction, learning more about recovery, which then better helps you assist someone that's in recovery.
Yeah, those are great resources. I'm also wondering if you have input or perspective on how a person can support someone who's in active addiction.
Yeah, that's a tough one. I get asked that question a lot, and I'm going to give two answers, and they're probably the same from a treatment perspective and from a parent. As a parental perspective, for me, again, it goes back to recovery, being present, being supportive, not losing hope, walking side by side, recognizing it's a disease, recognizing, I tell our staff all the time, an individual can have 100 setbacks. The 101st might be the big change where they make drastic change. So I think, again, just being present, being supportive, being hopeful, trying to offer as many resources as you can for the individual. Recognizing the toll it takes on you. So obviously taking care of yourself. And there's different theories, where, there's sort of the hardcore theory, maybe from a parental perspective that says, I'm not going to enable them. I'm not going to keep giving them money. And I recognize that, I understand that. Again, I think it's the unconditional love, just loving them, being present, where they know at any time, I can call and have a listening ear. So I wish I had the golden answer to that, because I think, but I think, again, just being present and that unconditional compassion, I think, is huge, because the patients recognize that, the person recognizes that. And I think you can do that without enabling. I think you can do that without being taken advantage of. So, because they know if you care, they know if you're going to walk side by side, you're going to be there with them.
Absolutely. And I'm so glad that you mentioned that while you're supporting someone in recovery or active addiction, you also have to be caring for yourself. And I know we were talking about that sort of in the context of if you're supporting a loved one, but I know that some of our listeners are people who are working in this field. And I think any person working in the field of substance misuse would agree that the work requires a lot of patience and creativity and compassion, which is great, but also requires a pretty deep well to pull from. Where do you see the importance of self-care in your work, and how do you incorporate it into your life?
Yeah, I think it's very important. I think clinicians are very hypocritical. We talk about it all the time, right? And we get so enmeshed in our work, sometimes we forget that part. So, that's one of the things I'm huge on with our staff. I'm mandated. I'm every supervision. What are we doing to take care of ourselves? Are we taking time off? Because it's a necessity. We have to do it. For our staff, we're dealing with life and death every single day. We're dealing with individuals that relapse or that overdose and could pass away. We're dealing with stressful situations. So it's critical that we take care of ourselves. And for me, I always say self-care does, a lot of times I'll hear, well, I'm going to go home and spend time with my family. Sometimes that's not self-care. That can be really stressful, right? And so what I always say is self-care is self-care, self, right? So what do you do to take care of yourself? What activities? Could be reading a book, taking a walk, painting, just sitting in a room doing nothing. For me, I'm an outdoors person. So, I love getting out in the mountains and hiking. I'm a fisherman, bass fish. So I get my bass boat, go to the lake. But I think whatever it is, I think as staff and as people doing work with substance use, we need alone time. We need time to refuel, to get ourselves balanced again. And again, it's huge what it can be, but I really think it needs to just be that person by themselves doing something. Family time's great, but you still need that alone time. So And it can vary with individuals. Some people, once a week, some people every day. For me, late at night, I'm by myself, just in my living room, reading, watching. That's my time to sort of recenter too. So, but it is critical and we have to do it.
It's so critical. And I appreciate you talking about how broad self-care can be, because I think we used to have a definition or image of self-care that was like bubble baths and I don't know, maybe, hey, I'm not trying to, if a bubble bath is what feels good for someone,
right,
great for them. But I think we've been able to broaden the definition of self-care. And I think that's just beneficial to everyone to truly be able to choose what works for you.
Yeah. When I was in grad school, self-care, the image of self-care for me was like yoga, right? And I'm like, man, I can't do that. But yeah, it is very broad, and it's whatever brings you peace and whatever brings you relaxation. I think our staff does a really good job. Our staff does funny things, in group meetings where, just things to make it enjoyable, to make it fun, because the work can be stressful. And I think our patients see that. They see it. They see us having a good time. They know we love what we do. And I also think it's really, really important to teach our patients that, right? To teach them self-care, to teach them ways of, or for some of our folks, they don't know what to do for fun. It's been so, for some of them, they'll say, Tim, the only thing I've ever done is drugs. Like, I don't know a hobby. So working with our peers and staff, helping them identify things that's fun to take care of themselves. So I think it's important for staff, but also I think it's important for our patients to do it.
Yeah, and then walking the talk of I'm going to tell you as your counselor to do this. I can't go home and not practice any of it myself.
Right, that's right. Absolutely.
So you have touched on this, but most of us are impacted by addiction in some way. Most of us have some connection. So for an individual wanting to understand more about substance use treatment and recovery, maybe for advocacy reasons or personal ones, what other tools or resources would you recommend?
I think, an organization like Northwestern, reaching out to Northwestern, we have staff, we do trainings all the time. Our staff's always willing to talk to family members, just individuals from the community. It's very common if I speak, after I speak, I'll get phone calls. Tim, you were talking about medication-assisted treatment. Tell me more about that. So I think, reaching out to organizations, reading, the ASAM material, volunteering, any type of work, any type of facility, read into the facility, making sure, it's a place you want to volunteer, but if they do good work, volunteering, getting information, I think are all really good opportunities to learn more about this field, certainly.
That's great. Thank you. I'll be sure to link some of that information in the show notes for people so that they can learn more, and I'll link Northwestern's information.
Sure.
Too.
Absolutely.
So now it's time for the question we ask all of our guests. What does the process of awareness to action mean to you?
$1 million question. Do I get money if it's like the answer? Awareness,
yeah.
Right? To me, I guess it's gaining insight, knowledge, awareness, so you can take action. So you're more educated in the action that you take. I don't know. Is that a good answer?
Ding, ding, ding. Great answer.
Sweet. All right. Yes.
Well, Tim, thank you so much for being here and for the work you do in our community. Again, I'll make sure to include the information for Northwestern in the show notes so that people can reach out if they feel like, treatment might be helpful for themselves or a family or a friend.
Absolutely. Wonderful. It's been a pleasure. Thank you so much.
Thanks for listening. Make sure you subscribe to Awareness to Action so you can stay up to date with our latest episodes. We'll be back in 2 weeks with another great conversation.